So we are at the top of the hour, and I'm going to say good evening and welcome to Neighborhood Chats presented by VuTech. VuTech is a minority business, a family business that's really excited to welcome our viewers and our panelists for this really important conversation, the strength of a woman, health, economics, and equity. So this discussion is so awesome. We have an amazing young woman with us this evening, but first, some housekeeping notes. We are recording this conversation both via Zoom and Facebook Live. So if you would prefer not to be involved in the recording, please post comments and questions accordingly. For those staying with us, watching from Facebook, start a watch party and help us spread the word. And if you're watching from Zoom, go ahead and share the meeting passcode and ID with friends and family so they can join us as well. To keep us focused on the discussion, please be careful to keep your device on mute and your video in the off position. And if you have not already done so, go ahead and introduce yourself in the chat because we would love to know who we have with us today, joining us for the conversation and sharing your amazing comments and questions. But we're going to jump right in. And I want to open up briefly by introducing our panelists. And while I'm doing that, again, go ahead, share comments and questions in the chat so we can get things going. And for more information about VuTech, absolutely visit us at www.vutech.world. And if you want to get some additional information about VuTech, about our panelists and the organizations that we'll be discussing this evening, please take a look at our e-program, where there will be a link dropped in the chat shortly so that you can get more information. All right, so today I have with me Zsanai Epps, who directs two of the Black Women's Health Imperative, signature programs, My Sister's Keeper and Positive Period. And because we at VuTech are such proponents of historically Black colleges and universities, I cannot miss an opportunity to promote HBCUs. As I'm mentioning, Mrs. Epps is a proud graduate and a doctoral student in public health at Morgan State University. And she's just informed me that Morgan State is in fact the inaugural HBCU to graduate a doctor in public health. So of course, she seeks to obtain her doctorate in public health from this illustrious university. So I'm gonna go ahead and ask her to join the conversation and say a little bit about herself and about what she does.
Thank you so much, and I'm happy to be a part of this conversation, and shout out to all my HBCU fellows and everything that you guys are doing to lead the world. So again, my name is Zsanai Epps, and yes, I am directing two major programs at the Black Women's Health Imperative, My Sister's Keeper and Positive Period. But just a little bit about the Black Women's Health Imperative. We were founded in 1983 on the campus of Spelman College by Billy Avery. And the Black Women's Health Imperative was the only national organization dedicated to the health and wellness of Black women and girls, physically, financially, and emotionally. And we are committed to leading the effort to solve the most pressing health issues that affects Black women and girls in the US. And we do this through investments in evidence-based strategies. We deliver bold new programs and advocate health promoting policies. And so just a little bit about both of the programs, I guess, if I should go into them. Is that okay, Guileine? Okay. So the My Sister's Keeper program was conceived in 2015 with the idea of focusing on sexual and reproductive justice for HBCU students. We have since transformed the program and relaunched it in 2020 as a program that's dedicated to the health and wellness of Black women and girls, but specifically young Black women ages 18 to 30, whether they're on college campuses or in the community. So we've expanded beyond just working with HBCUs and really providing programming to young Black women, whether they're on PWI campuses, community college campuses, wherever they are. We want to make sure that we get this information to them and that they're engaged through advocacy and leadership development. We have 6 focus areas in which we center our programming around with our members. And so that's sexual and reproductive health, rights and justice, menstrual insecurity and stigma, gender discrimination and violence, anti-racism allyship, anti-tobacco, smoking and vaping, and last but not least, certainly not least, mental and emotional health. So that's our My Sister's Keeper program. We've established 11 chapters since the inception of the program in 2015. And so we currently have 8 active college campuses, MSK chapters, 6 of which are on HBCU campuses and 2 are on majority university campuses. Our Positive Period program is something new that was launched earlier this year. So it's our newest signature program. It actually started out as a campaign around menstrual insecurity. So we fundraised money to donate 2,000 menstrual cups to Kigali, Rwanda, as well as in Atlanta, Georgia, where our headquarters is. And through that, we received so much support and interest in that work that we decided to turn that campaign into the program, hence me leading it. And with this new Positive Period program, we're focusing on 3 things. So we're focusing on, of course, educating young Black women about menstruation and stigma, distributing menstrual products through our partners, as well as advocating for menstrual equity. And so we've added 4 partners, but we have 5 partners. They're in Darlington, South Carolina, Montgomery, Alabama, Puerto Rico, San Juan, Puerto Rico, as well as Baltimore, Maryland, and Washington, D.C. And so we've partnered with these organizations to not only support them in their communities, but to provide menstrual products, because we know that they're needed at a time where some folks are choosing between buying food and buying menstrual products. And so we've been leading the efforts with that. And I'm just so excited to introduce the My Sister's Keeper program, as well as the Positive Period program, to you all under the direction of the Black Women's Health Imperative.
Awesome. Thank you so much, Zsanai. That getting a fuller view and understanding of My Sister's Keeper and Positive Period, but also the Black Women's Health Imperative, which is an organization that, to be honest, I wasn't fully aware of. I had heard of the organization, and as we were doing research and gathering information for this neighborhood chat, had the opportunity to dig a little bit deeper in that, and so was so fortunate to learn that there were so many amazing initiatives going on for Black women, and also wanted to make sure that we're pulling out that it's not just about Black women, but how we're raising up our young ladies to become Black women that are taking care of themselves and learning to be not only leaders and forces to be reckoned with, quite frankly, but healthy, physically, emotionally, mentally healthy leaders and positive forces in the world. So I kind of want to get us started off a little bit and talk about, based on your experience. Number one, you have multiple degrees and are well-versed in public health, but also in your work with Black Women's Health Imperative. What would you say are some of the major areas for women's health that we need to be aware of and pay attention to, both on an individual level, so for us as individual women, but also as a community and as a collective?
Yes. So, we have a broad view of women's health, specifically Black women's health, right? So it ranges across infectious diseases, but also preventable chronic diseases. And that's where our focus pretty much lies. Since the pandemic and well before the pandemic, because of historical traumas that have been inflicted on communities of color, stress is the underlying factor for so many conditions that a lot of Black women are faced with. And when we think about stress, we think about all the factors that contributed to it: where we live, where we work, where we play, some of those things that determine our own health outcomes. I think because stress is the underlying factor, we know that there are some preventable things that can happen, right? Because a lot of folks are getting pre-diabetes, right? And that's pre-diabetes is right before you get type 2 diabetes. So you have a window to make some healthy lifestyle choices, to also decrease your blood glucose level, so that way you are no longer in the pre-diabetes range. So pre-diabetes is definitely among the rise for Black women. Think about high cholesterol, high blood pressure. All of these things can be preventable with some healthy lifestyle changes. Also HIV and AIDS, there's a lot of work that's being done around that, but Black women are still being disproportionately impacted by HIV infection. We think about obesity. Obviously, obesity relates to diabetes as well as cardiovascular health. But something more specifically that's impacting Black women is our mental health. And again, the underlying thing is stress. The COVID-19 has exacerbated so many issues that we've all faced. And then we think about the impact on the reproductive health of women during this time as well. So what can be done individually in the focus? Obviously, I think we start with some preventable things, and obviously some things we cannot change based on where we live. And so that's why we advocate and try to make a difference and make those changes. But, having access to healthy foods, getting physical activity, honestly, getting your mental straight. So having outlets to practice self-care, to talk to someone, and obviously get the affordable quality health care that you deserve. And then collectively, because we know that these issues disproportionately impact Black women, how do we mobilize around that to make sure that we say, okay, this stops with us. We are preventing these chronic conditions because we no longer will be accounted in that number of being disproportionately impacted. And so we have to advocate. We have to make those individual changes amongst ourselves with healthy lifestyle choices, but then also gather and rally to make sure that we are supporting policies that are health promoting, that benefit us. So I think, those are some of the things that I like to raise to answer that question about what we can do individually and collectively, especially when a lot of these chronic and preventable conditions are impacting us.
Which is amazing. And I want to tease out a little bit more about My Sister's Keeper with it, right? Because you mentioned this stops with us, right? We have to do something to make a change. We have to be the change that we want to see for women in Black and Brown communities to do better about themselves and for raising our young ladies. So give me a little bit more, if you would, Zsanai, about My Sister's Keeper. So what is it that My Sister's Keeper really digs into doing to help this health crisis that's happening with Black women to end with us and for us to begin to have healthier Black women and to be raising healthier young ladies? So if you would kind of dig into My Sister's Keeper a little bit more for us.
Yes, so certainly. So with My Sister's Keeper, like I said, we're focusing on the 18 to 30 age range. And what we do through our program, obviously, is to inform them about these conditions, right? Some of them have lived experience in which they are currently dealing with these situations, or having family members that, may have type 2 diabetes, may have high cholesterol and things like that. So we are providing the space for them to bring their lived experiences to this work. And then obviously when they bring their lived experiences, it has that space to share what they've gone through and how some of these policies and things impacts them. Then we're ready to mobilize them, right? Because we've informed them, we've trained them on these topics, we've done deep dives, they found their personal connections, and now they're ready to advocate, right? So they're ready to go to the Hill and say, well, this policy doesn't work for where I live. This is widening the gap of health disparities. But then also not only legislative advocacy, but also personal and self-advocacy, being able to know yourself and say, this I can speak to, I know my pain. There's this phenomenon about people not listening to Black women, not respecting that we do experience pain. And obviously this is all some historical things that have been put in place, but we're letting them know that you are in charge of your life. You can take control of it. So also teaching them about self-advocacy. How do you advocate for yourself and your family? How do you advocate for yourself in the healthcare system? And self-advocacy is really important to me. So I like to lead that because, although we are interacting with these systems, sometimes they don't know what's best for us, right? They're going off of these standards of what may happen, but as long as we get to know our bodies. And My Sister's Keeper is grounded in the work of the Black Women's Health Imperative that was started in the early 80s with Billy Avery. And at that time, it was the National Black Women's Health Project, where Billy, put together these self-help groups, right? And were working with these Black women because they didn't even know their bodies. They were so used to taking care of everybody else that they didn't even know what their vagina looked like. And that is important. So these are the topics that we talk to our My Sister's Keeper members about, and just showing how they can get involved and be able to support their the other Black women and girls in this world through their work. And so I think, with My Sister's Keeper, we're constantly expanding and looking for more ways to really support these young Black women, so that way they can not only advocate on their campus, right, but then also in their communities. We know that some folks, leave from states to come and go to school, and so they're able to practice these tools and knowledge that they've gained in their own lives. So it's not like we're giving them information and say, go do what you will. It's like, no, we're going to walk through this together, because it's a lifestyle. And when you have that ingrained, you can really show up for not only for yourself, but for the rest of your sisters.
Which is awesome, right? That's after all, the premise of what My Sister's Keeper is. It's not just that I'm looking out for myself, but that I'm also looking out for my actual sister, my best friend, my cousin, my neighbor, my community member, who may or may not realize that she's got something going on that may need some attention, but also may have some fears about going to get help for whatever it is that she may be feeling on the inside. That can be seen or not seen. What about our men, though, right? So we also don't live in this society on our own. So what is it, as you see it, and as the Black Women's Health Imperative sees it, that men can do? How can men be involved in helping to advocate for, assist, support women in being healthier and in advocating for their bodies and their overall health and mental health?
Yes, thank you for that. So we definitely have young men that are within our MSK chapters. Of course, when you see the name, you think like, oh, it's just all, females, whatever. But a lot, we say this for our college students. Whoever you are, if you believe in advocating for the health and wellness of Black women, you are a part of it, and you become a part of it because you can speak to it in spaces and really show your support in that way. I think about our lifestyle change program, CYL Square. So it's Change Your Lifestyle, Change Your Life. That is a program that we've branded from the National Diabetes Prevention Program at the CDC. And we have male coaches that are leading groups of women, right, and supporting in the efforts to make healthier lifestyles. We know that sometimes, even when it comes to a lot of health conditions, that Black women may be more impacted than men, but that's your support doesn't stop there with your own individual experiences. So we always provide opportunities for men to show up, show out, and to support the work that's being done. So doing that through My Sister's Keeper, also having that within our lifestyle change program, but then also even with Positive Period, right? Because not everybody that gets a period identifies as a woman. And also not every menstruating person gets their period talk from their mom or a female in their life. I think for me, when I, started to get my period, I got the most support from my dad. My dad was not ashamed to go into the store and buy my pads. He was not ashamed to make sure he had my Krispy Kreme donuts around that time or my Tampico juice. He was on it, right? So that's how you show up. You show up in the support of supporting the self-care practices that Black women, women of color in your life are doing, supporting them, alleviating that stress, but then also showing up and show out when there's programming, support it, donate. If you can't donate your time, donate your dollars. But also when it comes to advocating for policy, show up, show your support. It may not directly impact you, but it's impacting the women in your life that you love. So that's what I would say to that about having men show up and really be supportive in this space around women's health.
Which is amazing, right? Because I love the repeating of showing up and showing out, and what that means for the ongoing conversation that we have about being students and graduates of historically Black colleges and universities. That's part of what we've learned to do when we matriculate on an HBCU campus. And so I absolutely love that piece, and the piece of men being a part of the change. Men are a part of the solution, not just because, you know, your girlfriend, your sister, your mom may need something, but when you start to have daughters and your daughters need your support, it's important for young ladies to understand that men aren't against you, and that men understand, can be empathetic, and can support you in your physical, medical, mental health as you're becoming a woman and learning how to do this thing in the world, because it's not super easy, right? Being a strong woman is not the easiest in the world, neither is being a strong man for that matter. And we need each other in order to help be well-rounded individuals. You mentioned positive period in Kigali. And I wanted to dig a little bit more into what's going on in terms of women's health, Black and Brown women's health in other countries, because I know that positive period not only helps to provide information, materials, and support for girls stateside on the mainland, but also Puerto Rico, and as you mentioned, Kigali. So can we dig into a little bit more what's happening in other countries in terms of helping with Black and Brown women's health?
Yes, so in Kigali, our founder, Billy Avery, was actually able to go there. And, you know, there was a lot around what she can say and what she couldn't say. And because of just how some of those countries are structured, and just the blatant stigma and just culture of how they treat women with their periods, is still very much present today, where some cultures send women away when they come on their period. In some countries where women can't afford the products that they need, so they turn to rags, they turn to leaves, and they turn to certain things. But one thing that came out of just Billy being there, but then also me kind of hearing about what's going on and kind of doing the research, the women there are not defeated, right? So they're working to create their own sustainable products. So they're working to create their pads and things like that that they need to sustain themselves during that time. But I think what we came in to provide that support is that for menstrual cups, they are cost effective and they last longer. So it eliminates waste that most tampons and pads can contribute to. And that's been really helpful for countries like, and for folks in places like Kigali, Rwanda, where they have to take that into consideration, and having products that support them during that time also matters. But then there's another issue around that in which you have to address, which is menstrual hygiene, right? Because not everyone in some of these countries have access to clean water. Actually, even here in the US, there are some places that still do not have necessarily clean water. If you want to think about Clint or things like that, Flint, and places like that, where having that access is important. And you think about homelessness and things like that. So although a lot of these issues are happening internationally, they echo what's happening here in the States as well. And so what we've tried to do is provide that support, whether it's through sustainable products, and also contributing to the conversation. And it's you know, we think about it's 2021, and you can't really necessarily talk about periods or, you know, vaginas necessarily in places like Kigali, Rwanda, which we also know impacts the health outcomes for women and girls there. So you know, if there's anything else you wanted me to add, please feel free to let me know, but I hope I answered your question with that.
You absolutely answered the question, because we want to be thinking about what is it that goes on in other countries, right? We probably take advantage here in the United States, which many refer to as a first world country, which is a first world country. We perhaps take it for granted that we have the access to pads and to period and to tampons and to cleaning products, right? To helping to maintain that menstrual hygiene, as you mentioned. And so it's good to know and understand. And I'm going to take the opportunity to put in a plug for the Black Women's Health Imperative that, you know, hey, if you check out our e-program, you can get access to help donate to Black Women's Health Imperative, so that we can make sure that we're doing our part to help distribute menstrual cups and to help distribute information and support to girls that are coming into puberty and becoming young women. And I do have a question that I want to make sure that we're addressing, just to make sure that everybody's aware of. Could you tell us a little bit, Zsanai, or explain to us exactly what a menstrual cup is?
Yeah, so a menstrual cup, actually, well, I don't want to mess up because we're live, but I had some right there I probably could have shown you. I probably should have been prepared. So a menstrual cup is literally like a cup, right? And it's made of silicone, so it's biodegradable and it lasts longer. And it lasts up to 10 to 15 years. And so the way that you would insert the cup would be like you would insert a tampon, right? You would fold it and kind of stick it up there and make sure, and it would expand just like a tampon does, and it holds your period blood. And obviously when you pull the menstrual cup out, then of course there is your blood there, and then you would just dump it and clean it out. So it's you know, you have to be really comfortable with yourself to use a menstrual cup, but that's just what it is. It's literally just a silicone cup that you are inserting into your vagina to help with your period. And it's just more cost effective, and it eliminates waste.
Thank you for that. And it's really interesting. I was aware of menstrual cups prior to this, so I appreciate your explanation of that. But as you're saying, you have to be really comfortable with yourself, right? That applies to so much more than just your period. That applies to so much more than perhaps using or inserting or removing a menstrual cup. That applies to all aspects of women's health, right? You have to know your body. You have to know, what does it mean when that right shoulder is hurting? Or what does it mean when I've got this little, cramp in my stomach? Is that a menstrual cramp, or is that some other sort of cramp? Or what does it mean when I have a headache in between my eyes? Or if I have a headache at the base of my head? What do all of those things mean? And so that's such an important part of our health and mental health, and how we're addressing what needs to be done, and going to the doctor and being able to explain that to the doctor. And so is that a part of what is happening with Black Women's Health Imperative, My Sister's Keeper, and or Positive Period as well? And if so, can you give us a little bit of maybe a tutorial on how exactly you help women and girls become more comfortable with their bodies and understand what it is that's going on, and how to articulate that to a medical professional when they actually go and seek medical care?
Yes, it's absolutely in the foundation of all of our work. And I'll speak specifically, I'll take it from the lens of My Sister's Keeper, then Positive Period, right? So for My Sister's Keeper, that self-advocacy piece, and a part of that kind of training is like, how do you know yourself? How do you know kind of like your triggers and things like that about yourself? Do you know what something feels like? So just encouraging that and saying, don't keep that information to yourself, be willing to share it. And so storytelling, authentic storytelling, is really at the base of the work, because you want folks to be comfortable enough to share their experiences. So when we talk about our Positive Period program, we have these positive period conversations, right? And so a part of these conversations is telling your story. So whenever we do our Positive Period conversations, we start off with, tell us about your first period. And when folks share that, they're like, no one has ever asked me about that. Or I didn't know that, some folks, probably don't get their period until they're 19. And so when you hear others sharing, you're a little bit more comfortable to talk about it yourself. And what we found is, like, having these spaces, we get so much feedback from folks that say, thank you for providing this space. No one has ever asked me that. No one has ever taken my story and showed me how I can use it to my ability. I think for me, even being a part of this organization, because I've been here full time for 4 years, but I started out as an intern, right? I interned as an undergraduate student, I interned as a master's student, and now I'm here. And so being a part of an organization that supports that, I probably share my story too much in the work, but it keeps me honest to the work. And then I also touch other folks when they see that, okay, you're fully ingrained into this work. It's not just a job for you, it's everyday life. And once you show folks that all you're doing is just talking about who you are And as you talk about who you are, you begin to explore other areas of yourself that you would not necessarily bring out, right? But because you have this community, because you have this safe space to talk and share your experiences, you're more likely to do so. So when they share these experiences in these safe spaces that we provide, you can't tell me that they're going to let the doctor say whatever they want to them. They're going to, they're going to stand up for themselves and be able to speak from a state of power, right? And not feeling defeated, because not every Black woman is in bad health. There are a lot of Black and brown women that are healthy. And so we take it from that standpoint, that you're resilient, you're healthy, you're not beaten down or anything like that. So when you create the space and support in that way, folks are more likely to share, more likely to stand up for themselves, and really stand in their power when they are coming up against challenges, even in the healthcare system or any system that they interact with.
That's amazing, because again, not only are we talking about advocating for yourself in terms of your health and your mental health, but we're also helping to empower women. We're helping to develop leaders. We're helping to develop activists and public officials and mothers and sisters and daughters. So that's just truly, truly amazing work, and transcends so many aspects of our lives, that it's so important that we continue to understand how health impacts every aspect of our lives, how understanding our bodies and how we're telling an authentic story about who I am to myself, first and foremost, but then also to the world, can be so empowering and so important for my health and for the health of everyone around me. So Zsanai, you talked a little bit earlier about diabetes. And of course, we've been talking about periods and menstruation in women. What are some of the overall trends? Of course, we know diabetes is a trend, specifically among Black women, but are there other trends? Are there other health trends that we can talk about in terms of what we need to know, what we need to be aware of, what we need to be keeping a pulse on, so that we're becoming educated, both educating ourselves and working to educate our daughters, our mothers, our sisters, and our best friends?
Yeah, so when I think about trends, right, I guess the most current trend is COVID-19 and how it's impacting women of color disproportionately. It's impacting us in literally every area of our wellness, emotionally, financially, physically. Black women are dying. Black women have been dying from maternal mortality crisis in hospitals, and not only losing their lives, but sometimes infant loss. So COVID-19, maternal health. I mean, I just can't express enough, even when it comes to reproductive health, cervical cancer, some of these things are preventable, in a sense that having access, having the means and things like that to be able to afford treatments and things like that is important. But when we narrow everything down, and I keep saying this, but it really, really comes down to stress. You can see stress in everything. So the trend is stress. I'll say that. It's how stress is showing up in your body, because stress can also exacerbate an asthma attack, right? But asthma rates may not be as high, but that's something that can trigger it. But that's also something that can be managed. When you think about stress and mental health, a lot of folks are, having an increase in anxiety, depression, and things like that. So again, stress, like what's bringing that on? Obviously, for some folks that have mental illness, that may be a chemical imbalance. And I can't really speak to that, because I will let the professionals and experts in that area speak to it. But I also know how it shows up just in terms of the everyday lives of Black women, because you have to deal with so much. And because of the weight of some of these diseases, but then also the systems in which we have to interact with, it further exacerbates the lack of access to even support creating a healthier life for, Black women and girls and women of color. So I hope I answered your question. I don't know, I probably felt like I was rambling, but you can center me again.
You absolutely answered the question. And we can also do some centering as well. It's talking about the trends, and I think you hit the nail directly on the head in talking about stress. and the impact of stress on so many different areas of our lives. And you defer to mental health professionals regarding stress and how stress affects us emotionally. As a licensed clinician, I will say it affects, as Zsanai said, every aspect of your life. And it's so important to be able to incorporate coping strategies and understanding when it's important to get help, understanding what you can do to manage your stress along the way, which not only means managing your emotions and your feelings and your mood, but also means getting a handle on yourself medically. It means getting a handle on your health, because if you can lower your stress, then more often than not, Zsanai said it, and I'm going to co-sign it, most often than not, it can help to manage, if not mitigate and prevent, other medical conditions as well. We know that stress, as you said, really does exacerbate so many other medical conditions. And so, you know, I think it's amazing and awesome to hit the nail on the head and to say that overall the trend is stress. And if we can do things to lower stress, then we can do things towards improving not only our mental, emotional health, but also our medical health as well. And so we said stress, and I wanted to kind of go into a little bit of the signs and symptoms that we may notice in ourselves, as well as signs and symptoms that friends, family members, and the men in our lives may see in us that either we don't see in ourselves or we're concerned about getting help for, because we don't want to know, we think we don't want to know what may have transpired as a result of whatever it is that I'm feeling or that sign or symptom that I'm experiencing. So would you talk a little bit, Zsanai, about some of the signs and symptoms first that we would see in ourselves that may alert us to the need and to the importance of going to get some help, some support for whatever we're experiencing?
Yeah, so I guess, and I'll speak from my lived experience, right? I think one of the most easiest signs I'd say to spot is someone's mood, right? And you know, some people can be moody, okay, you know, maybe around the period of time you may get a little moody, but I'm just saying mood. So if somebody's naturally, you know, high spirited and you know, just always cracking jokes, and you run into them and maybe they're just really reserved and they're not really cracking jokes, and they may catch you off guard, and your thought would be, what's going on, right? And so obviously you want to be intentional about how you reach out to folks. It's like, hey, like, what's going on? I'm noticing that you're not really cracking jokes, you're not laughing at my jokes, what's going on? So seeing the shift in folks' mood. Also, just overworking, right? I think what the pandemic has done when folks are at home and things like that, you are more likely to put in those extra hours. And research has shown that Black women, we do not have to go over and beyond with our hours, honey, because the other folks are going to sleep and we do not need to overwork ourselves. So, you know, even when it comes to overworking and embedding ourselves into our work, those are stressors, right? If you're not creating time for yourself. Also, signs is boundaries, right? If your day is just full of any and everything, you never get time for yourself. And I say this for folks that are in homes with, you know, women that may exhibit some of these things, or even men, right? If you're so engrossed in your work and you don't even take time to eat, that is a symptom, right? Because you're not even meeting your most basic need. I know for myself, when I'm super stressed and I feel like I got to get so much done, I may not eat. Right. And so it's so crazy because my godmother would call me and she was like, did you eat today? And I'm like, you know, I just got someone. She was like, I don't care. You need to eat. Because when she asked me, did you eat today? And I said, oh, no. She knows that I'm in overload and I need to take a break and eat. But even some, you know, those are some basic things, right? And I mean, Guileine, I can refer to you because as a licensed clinical professional, I'm sure you can speak to more of those things medically that may be signs and symptoms. But I'm just thinking about some social cues, right? And we know that with COVID-19, it has exacerbated a lot of those things. A lot of people feel isolated, even when they're not isolated, right? And so what do we need to do around that? That's, you know, some cues to say, okay, what's going on? If you're not hearing from people, if they're not popping up on social media, you know, something may be wrong. And, you know, it does take some supportive folks to really reach out to those people and say, okay, hey, what's going on? How can I be of support to you? Because folks are carrying a lot of things. People can be high functioning, And it can look like high function and always doing something, never taking a break, or it can, be low function in the sense where they just don't have energy to do some of the things that that they would normally do, which can be cause for intervention.
It's really interesting because you did, again, hit the nail on the head, and just the impact of the simple things, the laughing, the smiling, the getting enough rest, the eating properly, getting enough substance throughout the day. Those are really the little things that not only affect your stress level and your mood and your emotions, but also affects your ability for your body to maintain good, positive health, right? And I'll add in there, if somebody's not getting physical activity, right? Are they working out like they regularly would work out? Are they going for walks? How sedentary are they? And so I think those are signs and symptoms that I would add that, oftentimes we really do know the people in our lives better than we realize we know them. And so when we start to see something that seems a little bit off, it certainly can behoove us to consider what we're seeing and to say something about it, to give them, again, that safe space to have the opportunity to say, I need to talk a little bit, or I need to vent a little bit, so that they can get the support that they need in order to either work through that challenge or go seek medical help so that they can work through that challenge and get on the other side of it. So I think those are some really awesome signs and symptoms, and they apply to not just our sister friends or our actual sisters and cousins, but also for our men. Men often will talk about, and I'm being very general here, men will often talk about the moodiness of women. Well, if you notice that the woman in your life, her mood has shifted, then that's something that you absolutely want to mention and want to consider having a conversation about, and maybe even seeking some assistance with, even if you feel like you're not well equipped for that, or it's something more than she just needs to vent, or, go out for a nice dinner or something of the sort.
Yeah.
So shifting just a little bit, and want to talk about, I want you to kind of put on, not that you haven't had on your public health hat all along, but specifically your public health hat for a little bit, and talk about some of the major areas or issues that need public support regarding women's health. What are some of the top issues that need public support, and what can we do in order to provide that public support that is so needed?
So I think of public support, I think about all that's happening right now. We look at Texas with the abortion ban. Oh my God, we need public support for that, because there are a lot of women of color that are being faced with issues, and it's basically a violation of their human right, and that's a reproductive justice issue. So of course, having access to affordable care, that's very important, and folks need to really continue to uplift that. Not everyone has access to insurance, not everyone has access to good insurance, but also be vocal about the experiences when interacting with those healthcare systems, because even though you have access, research has shown that minority patients get lesser quality care when they're interacting with that, right? So another thing to uplift is maternal mortality. Black women and women of color are dying for bringing babies into this world. You don't have to be a birthing person to publicly support that and figure out what's going on. Why are we losing moms and babies when that is the most precious thing anyone can do, right? To bring a child into this life, and to know that some of them won't make it out. So continue to publicly support that. I think even as general as COVID-19, public support, I know everyone has their personal opinions about COVID-19 and its impact, the vaccine and things like that. But in terms of how we show up publicly is doing the basics, wear your mask, practice, clean hygiene, do some of those things. If you don't want to get the vaccine, okay. If you want to get the vaccine, okay. But think about how you can publicly show out for the greater good. So of course, COVID-19, of course, maternal health, of course, abortion rights. Oral contraception. World Contraception Day is going to be on Saturday. We have so many events around that. We're trying to get birth control pills over the counter. The reproductive health of women should not be jeopardized. We all should have the autonomy to determine if we want to and have the right to parent a child or not to parent a child. That's one of the tenets of reproductive justice. Publicly support access to a lot of these things that support family planning, right? We know COVID-19 has maybe shifted a lot of young Black women's perspectives on family planning, right? Because there's so many barriers and so many things going on just to have a child. So also thinking about that. Rare disease is also something that could be publicly supported. The Black Women's Health Imperative, we just put together a Rare Disease Coalition. Please, visit our website to learn more about that. I'm not working closely on that coalition, but I'm sure I can connect you with my colleagues if you want to hear more about that. So rare disease, maternal mortality and maternal child infant health, COVID-19, these abortions, over-the-counter contraceptives, these are all things that folks can support publicly, whether you're a birthing person, whether you're a menstruator, also menstrual equity, right? We think about it, there are at least 30 states that still have tampon tax. Tampon tax or luxury tax is additional tax outside of sales tax that are put on menstrual products. Now, if folks are bleeding every month, why can't access to menstrual products be just as easy as toilet paper? They put toilet paper in the federal budget, but you can't put menstrual products, or you can't, toilet paper is in public restrooms, but why not menstrual products when menstruators are all over this country? So and we know adding additional tax is debilitating to low-income communities and low-income members who cannot, buy it. Homeless people cannot have access to it. Low income, young children. So if we know that that's something that's happening, why can't we have the access? So these are all things that should have us outraged. These are, health issues, right? But then they also impact us socially, where we live and things, just everything that impacts us. Publicly standing up and supporting all of these areas is so important. I'm sorry.
Yeah, you're good. You're good. Awesome. Awesome. You did mention rare disease, and that's something that I know I'm not familiar with. And so I'm guessing that we have some audience members who are not familiar with what rare disease is either. And while I understand that's not a coalition that you're directly working on, could you give us a little bit more, perhaps, Zsanai, on helping us to understand what rare disease is, please?
So rare diseases are diseases that affect, less than 200,000 people across the board, right? Across possible disorders. So I can't think offhand what a rare disease would be, but I'm thinking of maybe sickle cell, I'll say. I know that sickle cell disproportionately impacts Black communities and communities of color, but that is really a rare disease. So that's the context of rare disease. It's something that, impacts less than 200,000 people, and it's not something that impacts folks globally, if that makes sense. And I hope I'm doing rare disease justice. If there's anyone that has a rare disease and can set me straight, please do. I am welcoming it. And if you want to learn more about our coalition, please visit our website. And I'm sure we have some more information there.
Awesome. Awesome. Thank you. And you can visit the website if you access our e-program. We've got the program hyperlinked all over the place so that you can gain access to the Black Women's Health Imperative website, as well as, again, I'll say donate to the Black Women's Health Imperative if you so desire to do so. So we had a question in the chat. And so I want to pull up this question and talk about it a little bit with you before we get into some additional questions or some of the other prepared questions that we had discussed. And so the comments in the chat came up in thinking about women who are 18 to 30 years old. So perhaps that My Sister's Keeper demographic, there are issues of male behaviors that show up in the news a lot. So male behaviors such as rape, pressuring to have sex or to get involved in sexually transmitted infections and sexually transmitted diseases. So what do you think, Zsanai, about, or what are your comments about the demographic 18 to 30 and the pressures, the issues that the 18 to 30 age range of women face as a result of male behaviors and how that's impacting our health and mental health as women and women of color?
Yes. And so when we think about that age range and think about some of those things, of course, sexual assault, as you know, has always existed and truly on a rise on college campuses, because you think about other things that are happening, but no one deserves to be assaulted. And a lot of women and sometimes men that are sexually assaulted, but we're speaking about women specifically, that are impacted, that weighs on them. And so stigma comes in. And, you know, they may not be comfortable with their body because they may start to think that their body is the reason why they were assaulted and things like that. So that does sometimes come up into conversations that we have about certain topics. It also impacts how women are comfortable with themselves, right? So even after someone has been assaulted, being comfortable looking at yourself again, feeling connected to yourself. And so these are some of the things that are underlying, right, within the history of our organization. And we can't not only think about what happens in the 18 to 30 range around assault and things like that, but also we have to also bring into the conversation just what happens with families, molestation, incest, and things like that disproportionately impact Black women and women of color, and how that trauma can be carried on from childhood up into their 18 to 30 range, and a lot of the things that they carry with them. I advocate for and I promote therapy. I understand that therapy is not for everyone, but I do believe that everyone should have someone that they can talk to and share their experiences and just be able to get it out, because a lot of folks feel silenced. So I know that is, what's, happening, and that's the conversation. And I also just saw in the chat that someone brought up human trafficking, which is really, really a big thing. And of course, I went to school in Baltimore, and I remember that being a thing. And, just really speaking with young Black women about their safety and just being on alert and not being so trusting, and kind of some of those, I wouldn't say basic things, because you never want to dismiss people's experiences, because you can do everything right that someone says and something still traumatic can happen to you. But just being aware of what, trafficking looks like. I remember for me, I had experienced something similar where I was, in a restaurant. Well, I was in Panda Express, and I saw this young girl and she was selling candy, but I'm like, how are you selling candy at 8 p.m.? And, I was with my friend, and I was telling her, I was like, I think something's going on, right? Because typically, they'll say with sex trafficking and things like that, there's always going to be someone that's monitoring whoever they're trafficking. And, I didn't think anything of it. So I asked, the young girl, I said, well, what school you go to? She said, Suitland High School. Well, I'm an alumni of Suitland. I know daggone well Suitland doesn't have students selling candy at 8 p.m. at Panda Express. And so I began to watch my surroundings, and I began to look around, and I saw a guy like directly staring at us, monitoring what she was doing. And I was telling my friend, I'm like, I think something is happening. And I don't think she should be selling this at 8 p.m. And, of course, my friend was like, you're being dramatic or whatever. And actually, I wasn't being dramatic, because maybe like a month later, it was on the news in Prince George's County that that individual was trafficking young girls. And so even knowing that experience and being able to share that, it's like, well, we have to know the signs, right? Because who's selling candy at 8 p.m. in a uniform? And that's probably not even the right uniform for the school. But just, again, having those conversations about what's happening and being able to recognize what's happening. And I'm not speaking about this to say that I know all the answers or that the Black Women's Health Imperative has all of the solutions and resources to mitigate this, but this is where we all come together, no matter male or female, to be in support of programming that supports, funding that supports, and just also that space to support those that are impacted.
That is awesome, because that's exactly right. It's we don't all have the answers. We don't know exactly what to do all of the time. But if we go back to this, that tried and true statement that we've been hearing for so long, if you see something that seems off, that seems odd, then you say something, because it's better for you to say something and be wrong than to not say something and there was something actually going on that you could have helped to prevent, or you could have saved somebody's life in various ways. And so we've talked about rape and sexual assault. We've talked about rare diseases. We've talked about, being each other's advocates and supporting each other. We've talked about diabetes. We've talked about abortion rights and reproductive justice. And so I want to feed that directly into what is it that we can be doing and helping people to understand the importance of voting, the importance of being involved in what's happening in our country, in our city, in our state, and in the country at large. Talk a little bit, please, Zsanai, about the importance of voting and what we need to know and understand, and perhaps how we may get information about going to vote in our local and national elections on topics that are going to directly impact Black and Brown women and our health and mental health.
Yes, and I definitely want to start off by saying I absolutely understand the mistrust of our community when it comes to politics, voting, elections, and feeling like the policies that are in place and just, the blatant attacks on our voting rights and being able to participate in the democratic process. I fully hold space for all communities that have the mistrust for that. And then I want to just go into, as an organization, the Black Women's Health Imperative, we've established our national health policy agenda. And with the health policy agenda, it focuses on topics that impact the health and wellness of the Black community, whether it's the Black woman, her family, the Black man. We've addressed that in our policy agenda, so I encourage everyone to go and read that. The policy agenda is a tool, right, to have those conversations and see the recommendations that are health promoting and not a detriment to our community. But then I want to switch back into like the local elections, right? So I know some folks probably feel like, well, I only need to participate in the elections for the president. Well, actually, there are elections that happen right in your city, your state, and your county that you need to be a part of, because those decisions at the local level are directly impacting your day-to-day as you go to and fro these, throughout these cities. So being able to, vote for who you want as your police chief, vote for who you want as the district attorney, as the judge, all of those people in those places, or this perceived power place, we have to vote them in. And when we don't show up, the people that do show up, that are supporting them, we don't have a say in how they, lead or whatever, if we don't show up. So it's very important for us to show up to not only things that are happening at the national level, but what's happening at the local level, because that at the local level directly impacts what's happening. They oversee the budgets for the county, they oversee the budgets for the state, they oversee the budgets for things that directly impact you and the community in which you live in. And I know some people can feel discouraged, right, from saying, well, my vote doesn't matter, but it does, because we have to show up and be in support of who we think best that can lead us to ensuring that we have a healthier community and in turn having a healthier life. So it's so important. It's so important to do it at every state. You know, the Black Women's Health Imperative, we do go to Congress and meet with representatives to talk about policies, to see if they're in support of it. We, you know, provide trainings for our program members to be able to do the same thing, and trainings to be able to talk about these things that are impacting the community. So voting is so important. I know it feels like, you know, for some that it doesn't matter, but it does. I also know that something that's brought to the conversation about voting is representation. We know that there are issues of all kinfolk and all skin folk and kinfolk, and we understand. And I think those are the nuances that happen for a community, but we have to think about what's the best, and the best for promoting the equity across the board for our communities, and to make sure that we are living healthier lives and living longer lives. And some of that is determined by our right to vote, and to vote people into quote unquote power that are making the decisions that directly impact us at all levels.
Awesome, awesome. Because I have to agree with you, Zsanai. It is really important for us to vote in every election that impacts us. And you're absolutely correct. City, county, state, and national elections are all equally impactful for all of us, because that's how the things that affect our day-to-day lives, the things that affect what's going on in my house, directly outside of my home, on the street, in my neighborhood, the school that my children may go to, that's how those decisions are made. Super important last year to have been involved in the census, because that's how funding gets distributed that affects my community, that affects a landfill in my community, or the amount of funding that the school down the street, the elementary, middle school, or high school down the street will get. So I have to believe, and I do believe, that that's equally important when it comes to matters such as reproductive rights and reproductive justice, and what happens when somebody is sexually assaulted, or what tax is imposed upon items that are necessary for our general health and hygiene. And if we don't stay clean, we know that if our private areas don't stay clean, then bigger issues can come into bear. And we definitely need to work towards avoiding having those bigger issues to come to bear. So we had a comment in the chat, or a request in the chat, for some coping strategies that will help with stress. And we mentioned some of them, but I just want to repeat a little bit of them to give our audience some information. And you let me know if I've hit any, or if I've missed any that perhaps My Sister's Keeper or Positive Period didn't mention. But some general coping strategies, and coping strategies can be, from a clinical perspective, very individual and very personal. What works for one may not work for another, and what works for one in one situation may not work in other situations. But some common everyday things, such as just relaxing and reading a book, or doing regular exercise on a regular basis, you know, getting 20 to 30 minutes of high-paced cardio activity helps to reduce your stress. Engaging in some form of meditation, whether that's spiritually focused or not, giving yourself an opportunity to sit in some quiet time and do some deep breathing are some excellent coping strategies. Doing things like going for a walk, whether it's in the morning or in the evening, whatever time of day works well for you, just going for a walk and giving yourself an opportunity to get some direct sunlight, breathe in some fresh air, are some also excellent coping strategies. Talking to your girlfriend, talking to your boyfriend, talking to your aunt, your uncle, your brother, your sister, whoever it may be, just having a conversation and sharing your authentic story about what's going on with you in your day-to-day life is an excellent coping strategy to help you release whatever is on your heart and on your chest. And so some common everyday coping strategies that we can use: getting enough rest is a coping strategy, right? Because it's important. Rest is involved in emotional regulation. And so if we want to make sure we're getting enough rest, you know, some people say, oh, I can survive on 2 or 4 hours of sleep. And while you may be able to believe that you're functioning, if you're functioning at a level that is adequate, is to be questioned with 2 to 4 hours of sleep. And so making sure that you're getting adequate rest. Also making sure that you're stimulating your mind. right? Reading a book, reading a newspaper, doing something that's going to help you to learn something and to grow can also serve as a positive coping strategy. We do want to focus on positive coping strategies because we know that there are also negative coping strategies. And while a glass of wine a night may be a positive coping strategy, drinking to the point of passing out is a negative coping strategy. And we do want to make sure that we're avoiding those negative coping strategies. So just wanted to throw a few out there for folks to have something to think about, and kick it back to you right quick, Zsanai, to ask you if there are any coping strategies that you can think of that I missed, and also just, some final comments as we're beginning to wrap up here on this neighborhood chat that you may have to share about either the Black Women's Health Imperative, My Sister's Keeper, or Positive Period, and this is conversation that we're having.
Yes, so you mentioned a bunch of them that I was going to, and we like to talk about coping strategies in the realm of self-care, right? So all the things that you've mentioned are all things to practice self-care. I think one of the ones that I like to uplift is celebrate yourself. It's so much going on, and we do not have to wait for big things to happen to celebrate ourselves. We deserve it. I mean, waking up in the morning and doing the most basic thing, from brushing your teeth, washing your face, and washing your body, celebrate that. Treat yourself to a nice breakfast or something. It's so much going on. You have to find time to celebrate yourself, to get through something that may trigger stress for you. I also think about another coping strategy, right, is protect boundaries. Having boundaries, really standing on your boundaries. If you say that you are taking an hour for yourself at 12 p.m., stand on your boundaries. Do not respond to the text you just got at 12:01, because that's how you can cope, by establishing your boundaries and saying, at this time, no, and no distractions. So that's the strategy that I would ask folks to employ. One other thing, and this is my personal one, I do crying cleanses. I'm not encouraging everybody to start busting out crying, but I'm intentional about it because, we carry a lot of stress in our shoulders and our back and our lower back, and we're not realizing what we're carrying with ourselves. And so I tell people that I've scheduled time to cry. Nothing has to be going on there. I could have a good day. That could be tears of joy, but just releasing that is so important. And sometimes when you are crying, you're releasing things that you probably have pushed deep down, and for it to come out, I think that's really effective. And you start to connect with yourself a little bit better. So that's something personally I like to do. I like to get my nice little playlist together, put a little Mary J. Blige, My Life, a little Solange, Cranes in the Sky, and really get the tears rolling, right? But I feel so much better afterwards, because there was a point in my life, because I wanted to, do everything and be everything for everyone. I lost my mom. I kept going. I graduated from college. I also inherited my little brother. He was 6 years old at the time. He's 13. Pray for me. And so I've been like momming my little brother, a sister mom, for the past 6 years, and that creates stress. I'm also trying to break generational curses. I'm the first person in my family to graduate from college, get a master's, and go into the doctoral program. So I'm doing all these things. So I have to practice positive coping strategies. I have to practice self-care, and I have to create space and time for my body to heal and release anything that I may have been holding in that I did not let out, because your body would do it for you. Sometimes I remember just going and I would just bust out crying. I'm like, why am I crying? Nothing's happening. My body is saying, you have so much built up in you, it needs to come out. And so finding ways to release that, I don't know, going to the batting cage. I don't know, there are like these new rooms that you can go and destroy, hit it with a bat, having to get it out, not taking it out on other people, but, just finding those outlets to do those things is so important. And our positive coping strategies and self-care practices that can truly be supportive to you in this life. And I guess in terms of wrapping up, I thank you all for just being a part of the conversation. Thank you, Guileine, for everything, and thinking of the Black Women's Health Imperative to be a part of this discussion. As always, if you guys want more information, please visit us at bwhi.org. We're on social as well, at the Black Women's Health Imperative or the National MSK. I believe in the e-program, we do have information about our lifestyle change program. So you're happy to go to our website. We have publications. The National Black Women's Health Policy Agenda is there. We actually did a pandemic guide, right? We actually broke down the CARES Act. And so, you know, we have a lot of publications and information that's really supportive to the Black women that we serve. And as a national organization, that's important to us. So thank you.
Thank you. Thank you. That's awesome. I love those additional coping strategies of scheduling time to cry, or just realizing when your body is telling you that you just need a release. And it's okay to give yourself permission to take time for that release. And we have, you know, Deborah, our resident MD in the chat, who's saying, yes, celebrate yourself, but also choose to laugh and play on a daily basis. It's so important to just laugh and play, even if it's just watching some comedy clip on YouTube for 10 or 15 minutes. It's so important to give yourself that opportunity to just laugh and just play on a daily basis. I thank you so much, Zsanai. You've been a wealth of information and truly had an amazing conversation, not only about Black women's health, but what we're doing, what can be done about helping to usher in our young ladies into womanhood and into adulthood, and what we can be doing for each other as sisters, as friends, as aunts, as uncles, and what our men can be doing to help to support us to live healthier lives. We will, of course, have a men's health conversation in season 3 of Neighborhood Chat, which will be in 2022, but we wanted to get this conversation in with Zsanai Epps and discussing not only what's great about the Black Women's Health Imperative, but what's being done nationwide for Black women's health and equity. I will also invite you again to take a look at our e-program, which, as Zsanai mentions, has great information about the Black Women's Health Imperative and the amazing programs involved in the Black Women's Health Imperative, as well as, of course, hyperlinks to their website. And again, if you so choose to, you know, give them a few dollars, or if you decide that you want to find a way to volunteer your time, if you're in the Washington, D.C. metro area or in the Atlanta area where they have offices respectively. So, and there are also some other organizations that offer assistance and support for Black women's health included in our guide. You know, the Olympians, so a lot of our Black Olympians just recently showed us how to be empowered and how to make sure that we're taking time for ourselves and we're engaging in self-care, even if it means giving up the gold medal, even if it means giving up that opportunity to be on a major stage and to win, you know, a Wimbledon Cup or something of the sort. We have so many amazing examples of strong Black women who are helping us to all be strong Black women by taking care of ourselves. And so I think it was so important for VuTech to do this conversation on helping to support each other and helping to understand that the strength of a woman really does require good women's health, as well as being engaged in what's going on with us economically and what's going on in terms of women equity around the world. So again, thank you so much, Zsanai, and the Black Women's Health Imperative. Our next Neighborhood Chat, October 27th, which will round out season 2 and our first full season of Neighborhood Chat, will be on the money mindset, empowering wealth and financial abundance in Black and Brown communities. So absolutely join us on October 27th at 6 Eastern. And as I said, we'll be discussing empowering individual financial wealth, shared economic abundance, and universal prosperity in Black and Brown communities. And so, of course, again, thank you, Zsanai, and the Black Women's Health Imperative. She's up there in Fort Washington, Maryland, in the Prince George's County, Maryland area. And as I mentioned, there is also an office in Atlanta, Georgia. Thank you to the VuTech staff and family and our interns that we've got working behind the scenes, helping to make sure that things go really, really well. We'll also mention that we have our next major VuTech initiative, VCAF, which is virtual career and college fair, specifically geared toward historically Black colleges and universities, helping our young folks find their way to historically Black colleges and universities, or whatever is for them to come next after they've achieved their high school diploma or their GED. So absolutely, thank you to everyone. If you want to stay connected with us, please drop us a line at contact@vutech.world, or find us on social at VuTech Online, Facebook, Instagram, and Twitter. So again, thank you to our sponsors and to our viewers. We do what we do for you because we believe in better tomorrows for all of us in Black and Brown communities. Because we know if we have changed just one life, then we know that we have changed the entire world. So thank you, stay safe, and good night.